XLH is a whole life, whole body disease with many of the mental health challenges that come with having or caring for someone with a rare disease. In this interactive discussion, we will hear about some of the mental health challenges for people living with XLH, as well as coping and management strategies, and when and how to access support. I am pleased to introduce Dr. Maya Doyle, an Associate Professor of Social Work at Quinnipiac University. She sits on the Scientific Advisory Board of the XLH Network and serves on the Committee for Rare Disease Day at Quinnipiac. She is joined by Dr. Jennifer Gentilly, attending psychologist in the Division of Endocrinology at Boston Children's Hospital and instructor of psychology at Harvard Medical School, with a background in genetics and experience working with children with genetic disorders and their caregivers. They are joined by fellow patient and friend of mine, Amber, as well as Carrie, a caregiver, and Mike, her husband, who also has XLH and who are both dear friends as well.
Hi, everyone. There's my wonderful panel. Hi, guys. Nice to see you again. Hello, everybody in the audience.
Hi.
I'm really thrilled to be here today to talk about this important topic of mental health in rare disease, and particularly with XLH. Um, as my welcome committee there mentioned, right, living with a rare disease can be particularly challenging because often the folks in your support network, your friends, your family around you may not really understand what that experience is like. And even if you're seeking professional help, they may not really understand what that experience is like. So we felt like it was important to sort of start talking to each other about that and how we can better use the resources that are out there. I'm going to talk today with this panel about three types of care. We're going to talk a little bit about professional care when you might go to a social worker or psychologist, someone like that for help. We're also going to talk about the importance of peer support, things like the XLH network, but also all the groups that you might be part of at home, in your community, or in your church, or your book club, or all those things where we get support. And we're also going to talk a little bit about self-care. And I have about 5 questions I'm going to throw out to the whole panel. I'm just going to tell you guys up front so you know what I'm going to ask them. I'm going to ask them about some of their biggest challenges after they tell us their story. I'm going to ask them about the kind of help that they've received, whether it's professional help, things they've done for self-care, things they've done to get peer support. And I'm going to ask them, most importantly, at the very end, what has been the thing that's helped them be resilient? Because I think that's what we all really need to end on. There are lots of mental health topics that we might cover. We didn't pick any particular ones, but there are all sorts of things around adjusting to illness, adjusting to an injury, adjusting to how you might feel. There is, of course, with XLH, pain and fatigue and different challenges that way, changes in function that folks are adjusting to. Certainly, we want to think about anxiety and depression. We also want to think a little bit about the trauma of both injuries and surgery, and that can really impact folks. We may want to just help make changes in the way we do things, and sometimes we need help in making those changes. And of course, for those of you that are parents in this group, right, you're also trying to take care of you and take care of your kids. So we have all kinds of things going on here that we might be juggling. So I'm going to let our panelists now introduce themselves and then tell you a little bit about their stories. So guys, take it away.
Hi, I'm happy to go. I'm Jennifer Gentilly, and I've worked for about 18 years now working with folks with chronic health issues. And my goal is how to help people live happy and productive lives, be able to be your best selves and cope with the challenges of chronic illness, including things like XLH and other challenges. And so I'm here to help, a little bit kind of from the medical side of things and understanding, but it's very important to hear stories. I think this panel is so important because it's much easier to relate to peers. As much as a clinician can say something, it's super important to hear the stories of folks who with those lived experiences. So thank you for this, and I appreciate this important panel. and important conference. Thank you.
Amber, you want to go next? You're at the top of my screen.
Yeah, I'll go. Hi guys. So my name is Amber. I'm currently a third-year medical student at Weill Cornell. So I'm an XLHer. I was a spontaneous case. So the way my parents found out I have XLH is I'm the middle child. So my mom had like my older sister to base everything that we do off of, and she noticed that I wasn't walking as soon as my sister did, and I wasn't like standing on my own. And a bunch of doctors told her, yeah, she'll be fine. Every kid develops differently, like it'll be okay. But it wasn't okay. We found my endocrinologist who was like, yeah, this is not okay. This is like something else. So I was diagnosed when I was about 2. I've had like a ton of surgeries along the way. But the one awesome thing about XLH in my life is that it's kind of given me purpose in the sense that now I want to be a doctor, and like I want to work at the intersection of like orthopedic surgery and endocrinology so that I could work with this patient population. So yeah, that's my story.
Sarah, I'm going to pick on you next.
Hi, I'm Sarah. I have XLH myself. I was diagnosed at about 1.5. I was a spontaneous case. I have 2 daughters. One is affected by XLH and one is not. My daughter with XLH had guided growth surgery just this past March, and she also struggles with anxiety. She has OCD and also generalized anxiety disorder. I'm a mental health professional. I'm a school psychologist, so I can kind of see both pieces of that. I guess that's it.
Go ahead.
Mike Carey.
I'm Mike. Sorry, I already jumped the gun. I'm Mike. I was diagnosed with XLH at the age of, it was around 7 or 8. My mother was diagnosed the same day I was. She had lived her whole life without realizing it or knowing it until that day. My mother was a spontaneous case. I've spent the majority of my life until my early 30s trying to ignore XLH, which is not very easy, and only have taken a huge interest due to my daughter having XLH now, and it's changed my whole world as well as my wife's.
And I'm Carrie, Mike's wife, and as you just heard, I'm a caregiver to my daughter who's 10, and I call it a cheerleader to my husband, because as you all know, with XLH, there's good days and not so good days, and but we get through them. And I think we've both found since having our daughter and researching more about XLH, just how beneficial it is to connect with others and help and share our story. I think that's helped us.
So maybe each of you can kind of share with us a little bit, just in terms of mental health and coping. What have been the big challenges across the years? Mike, you want to go first?
Yeah, sure. I didn't know if we're going the same order or whatever. You just keep calling names. Like I tried to explain, is I've tried to ignore XLH as much as possible. I was shorter than everyone in my class. I had the bowed legs, but I was able to keep up. I definitely had growing pains through the years, and I got to be honest, when I did have those, I don't remember what was done. I know I was on a regimen of KFOS and Rokeltrol all through my growing years. However, once I got to about 18 or 19 years old, I stopped taking those drugs, and I was virtually pain-free for a lot of those years. The only thing that I can really say was an issue was about middle school. I had started urinating blood, and because when you're in middle school, you kind of don't. When you're a boy, you're going through all the, well, girls too, everybody's going through all these changes. It wasn't something I brought up. It was something that was found through my yearly checkup with my endocrine. And what they had realized is that due to the amounts of KFOS they were pumping into me, I had atrophied a kidney and basically kind of urinated out one of my kidneys. Um, Unfortunately, it just took me off of playing sports and things like that. But as I grew older, without any sort of KFOS and vitamin intake on the side, my body started to deteriorate quite rapidly through my late 20s and early 30s. And that's when I really started to struggle. Luckily, I have had a positive life for quite a while. But my uh, early 30s, I am 39 right now. Early 30s, my weekend would consist of, sitting around on the weekends on the couch. I've always done physical labor as a job. Back then, I was doing water utility, water main breaks, lots of digging and, construction type work. So I would spend the week beating my body to, virtually a breaking point. And on the weekends is when I would have to recover and rest up and basically live a life on ibuprofen is um, and that gets me to my late 30s, which introduces Chris Vita and some other things, as well as with the introduction of my daughter and looking for help for her after realizing the help that I needed was finding the XLH network and connecting with a lot of you. Like I said, I spent a lot of my life ignoring it, and now I'm it's totally changed. I want to help. I'm happy to be a part of this. I go give speeches, which is great therapy for me. I realize how lucky I am after seeing some others that are out there with this disease and how it affects people so differently across the spectrum. But that's kind of my issues and whatnot. And then I have bad days just like all of you do too. I have good days too. So
Yeah, and I think I would just add, do you want me to go ahead?
Sure.
Okay.
Keep going, Carrie.
I would just add from a mental health perspective, I think some of the challenges we felt are, number one, when he was in his early 30s and he was hurting so much before Crysvita, I think it was really hard for him to feel that way and know that his daughter was going to go through that. And I think that weighed on you a lot.
definitely.
And I think I worried about, as she's getting older, her watching dad hurt and being afraid of what her future looks like. And then on the other side of things, I think another one of our mental health challenges was when Lexi was on Crysvita before Mike, because she was in a clinical trial. But once Mike was on it, I feel like there was a whole different feel because of him feeling so good now and almost like a new person. And some people have talked about this with, like, when they get done with like cancer treatments, some people feel like they're just a totally different person and they're trying to like figure themselves out. And I feel like we went through a bit of that as well, because it was just a whole new life and a whole new image of where life was going to take things. So I would say those were some of our challenges over the last how many years.
Thank you for sharing that. And it's really interesting what you say about how treatment changes life in such positive ways, but also really gives you a whole different perspective that you have to adapt to. So there's that constant change going on. Amber, how about you?
Yeah. So I share a bunch of the same sentiments as Mike. Like, growing up, I tried to just ignore it, which was really hard because I was like the only one in my family. And then I'm the shortest one every single year in school, and like I have these bow legs. But for me personally, I like, in ignoring it, I kind of convinced myself that I didn't have it too for a couple of years. Like, I played basketball growing up. I never really had any major issues with pain and stuff as a kid. I think my pain stuff started after I had my first surgery. Um, but like, for the most part, I was just able to ignore it. And I didn't really start to feel it until I was around like in my 20s. um i I just started to feel like really alone. I've had like 17 surgeries or something at this point. And I had just had surgery in college, and I was like, all right, this is awful. Like, I don't really have anyone to talk to about this. Like, no one understands what it's like to like wake up every morning and go to class with this smile on my face as I'm like on these crutches. But like the second I leave class, it's like, this is not a fun time. And so that's kind of how I found the XLH network. And then I don't think XLH really became real to me until I was applying to medical school. So I like wrote up my application. Like I had this personal statement. A ton of people read it for me. They were like, yeah, like you're ready to apply. But like I just couldn't hit send because I just felt like it didn't accurately represent why I wanted to become a doctor. Like I wrote this essay about wanting to help people and like do good in the world and stuff. And I just didn't want to send it off because I felt like it wasn't me. So I rewrote this essay about like the topic was actually about my scars, and how I had tried to like hide them for so long and wouldn't wear shorts. Like I was always in jeans just because like, especially after my legs are straight, I just kind of felt like, okay, this is like, I can actually live life and no one has to know that I had this. And so if I could just hide my scars and hide every single thing about it, I could just take my medicine in peace somewhere, no one has to know, then it'll be fine. So I think that's the first time that it became like super real to me. And I'm like super grateful for SLH Network. And like I did a ton of research and I found Dr. Carpenter, like just like online, a paper that he had written. And like since I was interested in like medicine and like this is what I wanted to do, I was like, oh my gosh, like I have to know this guy. And I sent him an email and he was like so nice, and he invited me to Yale to like shadow him for a couple of days. And so like that has been one of the most transformative experiences for me thus far, just because like like I said, like XLH was becoming a real thing in my life. And at that point, I was like, it's a real thing, not just for me, but for all these other kids. Like all these kids that I saw when I was shadowing him that day, I was like, that was my life. Like when he's going over all the vitamin D and the Rocaltrol and the FOS and all of that stuff, I was like, whoa, like this is literally what it was like for me to be like 11, 12 years old. And so, I mean, just to put that all into a mental health perspective, this is not something that you could just push through on your own. I feel like, especially for spontaneous cases, it's really hard because you don't even have like your family members to kind of understand what your day to day is like. But I mean, once I found that community, like my life has been way, 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 way better. Like I feel super supported. On my good days, I have people to talk to about it, and on my bad days, I have people to talk to. So support is huge.
Thanks for sharing that, Amber. I think you really bring up both the social impact of living with a chronic condition and also how over time to sort of figure out how to fit it into your own identity, right? Because we spend a lot of time kind of not wanting to include that as part of our lives. I really hear that in what you were saying. But how connecting with others and getting that support can really help change that. So that's wonderful. Thank you so much for sharing. Sarah, now it's your turn. Tell us a little bit about the big challenges.
I can also relate to the not really, can you hear me? Sorry. I can also relate to the not thinking a whole lot about XLH as a younger person. I'm mildly affected and really didn't give it a whole lot of thought growing up, or as a young adult even. It was when I became a parent that I started to really think, how is this going to impact my child? How is this going to impact me as a parent as I get older? Throughout my life, as a young adult in my late teens, I struggled with some depression and anxiety. I experienced a pretty significant loss around that time, and sought counseling to help me through that. But also my daughter with her anxiety, that has definitely been a challenging experience. And then adding, the anxiety on top of XLH and making sure that her doctors, and her doctors have been really great about understanding her anxiety and how that impacts her treatment. Like when she had her surgery beforehand, her endocrinologist said, this might be hard for her because of her anxiety. You know, we need to really think about how we're going to talk to her about that. And it's been really helpful to have doctors that understand that, and also having her therapist to help her work through some of those situations as well.
You actually sort of bridged us to our next question, Sarah, which was sort of if you use professional help for either yourself or your child or as a couple or any of those things, like, what was it like to decide to reach out for that help? And what were maybe some of the challenges too of finding the kind of help that you wanted?
I would say as a young adult, there was a stigma that I felt in reaching out for help. I'm glad that I took that step and did seek it out. I think as a parent, some of the challenges we ran into was finding the right fit. I think many of us have experienced as parents of XLHers, if a doctor, you know, doesn't fully understand the condition or maybe isn't a good fit, we would find a different doctor. Well, the same is true in the mental health world. We originally went to a therapist for Rhea, who she was fantastic, and she was teaching her all these great calming strategies and mindfulness, which would have been very effective probably if she had just had generalized anxiety. But some of the things that you would do for a child with generalized anxiety could actually make OCD worse. And so what we were finding, this is before we knew she had OCD, but we thought to ourselves, this isn't helpful. We need to find somebody else. So we did, and eventually we got the OCD diagnosis and found a therapist that specializes in just OCD, and that has made a huge difference.
That's right, but it took a while to find that right fit, and I think that's what a lot of
Yeah.
folks face, right? And especially with rare diagnoses, even with more common chronic illnesses, that's not necessarily what we're all trained in. We're trained in sort of broad categories, but not necessarily in specific illnesses or certainly specific rare diseases, unless you're like a few of us, right? And we invest our interest in that area. So it definitely puts often rare disease patients and families, right, in the boat of educating the people that you're going to get some help from. Jennifer, do you have thoughts as we're talking about this?
No, absolutely. You know, folks with rare diseases are kind of put in this unfortunate kind of position that you wouldn't, you know, necessarily want a 15-year-old, for example, being of doing that self-advocacy, and some of the strategies that you might recommend, you know, with somebody with chronic pain. It might be different with folks with XLH. You know, taking a break could be a very helpful recommendation versus somebody with another condition where the chronic pain comes from a different condition. You might have that recommendation. So it's I always find it's so unfortunate and frustrating. And the last thing a patient wants to be doing is to be educating that clinician, like you're paying them, right, to provide this expert service and not to kind of be the learner in that environment. So that's really unfortunate. And I appreciate, Sarah, that you pointed out it's from the mental health perspective, kind of independent of XLH, it is important to make sure you have that right diagnosis. I always say a good therapist is like finding the perfect pair of shoes or the right dress. It takes a while, right? And especially the area of the country you're located in, it could take a long time. So I usually recommend people schedule 3 appointments, just because you have to trust that person for your child. The child has to get along with that person, or else everybody's wasting their time, frankly. And also to echo, oh my gosh, Amber, the stuff about peers that you mentioned, that is just so important to say that. And when you have that rare disease, that it's probably unlikely you're going to run into somebody who has the same condition to truly understand what's going on. So having something like the XLH network can be super, super important. And I think particularly with XLH, because I've done a little bit of writing on his hidden disabilities, and you know, at the time the word disability, I don't think it had similar implications. So I would say hidden challenges, right? Because on the outside you can look fine, right? And you know, bowed leg, people wouldn't necessarily think bowed leg means some sort of medical condition. You could just say, oh, it's bowed leg, you know. And so I think that can be really challenging, that when you do need to take a break at work, or you are experiencing pain, or you have multiple doctor's appointments, if somebody has a broken leg, for example, or they have cancer, we know how, the community knows how to respond, how to, bring casseroles, or, pick a child up at work, something like that. But something like XLH, it's often hidden. So if there aren't these outward obvious manifestations, and there isn't this common language of, I have this, you help me in this way. So often requires that really direct kind of sharing with people, you care for in your life and who care for you. This is what can be helpful for me. And sometimes doing that self-disclosure can help you, and can help you. We're all in this together, right? This is this whole community of humanity. And I think it's a lot of it is, ignorance, and not, ignorance in a offensive way, but rather they just don't know, they just don't understand. So then people can make those assumptions. They're just not interested in working. Like if you're working as a waitress, for example, they need a break. No, actually they're horribly fatigued, they're in terrible pain, and you need to give them a break. So those are just some of my thoughts. So I appreciate that. And I'm going to go on mute.
Thank you, Jennifer. I think both of us feel really strongly about this, right? And, I know I've spent a lot of time getting to know about the diagnoses of people that I work with over time, but it's not always the first thing that we do. We've got a training of sort of how to provide mental health services. And I don't know if others of you have the experience of having to sort of educate a provider or a counselor about what you're living with. Mike, you're nodding. So I'm going to assume you have something to say.
Well, I just went through such a long period of my life where I couldn't get the answers. Even like going through the UW, I'm situated in Madison, Wisconsin. We have UW Children's Center. We have a great UW medical system here. But nobody could give you answers. They could explain what was happening to you, but nobody could like tell me how I was feeling and why I was feeling and what's going to happen to me. And that's where, like, from when I hit 18, 19 years old and I walked away from everything cold turkey, it was because of that I couldn't get those answers. And then as I got older and my life had deteriorated, literally, not being able to do a lot of things that I wanted to do, that I was able to do, then I started looking for answers. And luckily, I think, technology and a whole lot of other things kind of crept up while I took basically a 10-year break from everything is what it was. And now it's just amazing. And I just hope everybody can get the help they need, because there are answers out there, and there's this huge social network of people that you can relate to. People with leg pain, people with side effects from the drugs that they're taking and been described. My endocrine currently was not up to speed at all about Chris Vita and a lot of other things, but luckily I have a totally open-minded endocrine, and even when I want to change dosages and things to how I'm feeling, she's totally fine with it. She doesn't question me, she just goes with it, and she just wants to see the results and know that I'm doing well. So I've heard there's quite a bit of discouraging from people out there where their endocrine's unwilling to work with them, or and I like Jennifer said, schedule 2 or 3, therapists or doctors or endocrine. They're out there. There's people willing to, have an open mind to a lot of these things. Just try to stay positive. I know it's not easy because I was there for a very long time.
And like Mike mentioned, I think he worries about all the people out there that have XLH and gave up. Like, not gave up, but gave up on, that there's, future treatments, or that there's like, what else can I do for me? So they just stopped seeing their endocrines. And he's always saying, how do we find those people? Because I worry if we wouldn't have had Lexi, that would be him. No one would know he's out there.
Well, in some ways, I'm hoping, right, this ability to be virtual and be so more accessible in some ways gives us a whole new opportunity to reach out to folks. And, if these words are ringing true for our audience, like, I hope it's a way of saying, hey, reach out. And Sarah, what you mentioned as a young woman of, kind of the stigma standing in your way, I think one of the messages we really want to give today is like, the heck with that. Let that go. There are lots of people here who do know what it's like, and there are ways to sort of get started a little bit at a time. Like, Mike, I'm imagining that when you sort of, I don't know if you had a specific moment that made you say, okay, I got to do things differently, but obviously that must have been a process for you, right?
Yeah, it was definitely a process. Like, I mean, the biggest thing and life altering thing was knowing that you're going to have a child. You know, that was where it was like, okay, I can't have my child feeling like the way I'm feeling at 30 years old. You know, what can we do to get ahead of it? You know, what is now maybe out there that I haven't known about for 10 plus years. And yeah, I mean, and I got to be honest, without my wife, I know I give her a lot of credit and she deserves it, but seriously, I would just be piled up in a chair on the weekends. And I'm not. I'm an active fireman of 19 years of service. But you know, that was all on the line not long ago, where I was literally ready to walk away from the construction work. I was ready to walk away from the firefighting. And like I said, due to my daughter and my wife being so proactive and finding things through the XLH network, we were able to get her enrolled in a clinical trial where we were traveling to Indiana. We went to Indiana we were going like every weekend for like a month and a half. We'd fly out to Indiana, come back. It was crazy. And it got less that we were traveling out to Indiana for the clinical study of Chris Vita. But we continued that, and we still go out there yearly just to have Lexi's checkup, and I think I'm even involved in one of their studies too now, just to see how I'm reacting. So there's so much good out there now, that, like Carrie said, I want to figure out a way to reach everybody. How do you get the people who are discouraged and have walked away and no longer want to, look into this? How do you get them?
That's great. What a great message. And I think you're really talking about motivation, right? And Amber, you talked about that too, about being motivated as you were going into medical school and sort of seeing the other kids when you visited.
So I feel like Mike says so much that I just want to talk about. So one thing is like finding an endocrinologist that knows like what's going on with you. So I'm 26 years old, and like I still see the endocrinologist who diagnosed me, and she's a pediatrician. And so like I have to go to her office, and I'm like sitting in the waiting room with like kids next to me playing with dolls and stuff, and I'm just like, nope, I'm the patient. So that can be like really frustrating, and I worry sometimes because I'm like, what if something ever happened? Who else would I go to? And then I like in the short time that I've like been a student, I've already seen situations where people have just not been led down the right path, and it would have like been catastrophic had something not stopped them. Like I was like working with an orthopedic surgeon, and this woman came in and she like had hardware in her femur that she wanted removed. And she was like, yeah, like I've been having knee pain since forever, and like I was gonna go get a knee replacement because all these doctors told me just get a knee replacement. And like I saw her x-ray, and then I saw her lab work, and I was like, this lady definitely has XLH. And like she actually went and saw my endocrinologist, and she diagnosed her. And so this woman was getting ready to have like knee replacements to like fix something, and that wasn't even like the root of her problem. And so I can't imagine how many different like endocrinologists she went to and orthopedic surgeons that are just like, oh yeah, like take some pain medication, like have this knee replacement, and like it'll take all your pain away. So that's just like really frustrating to see, because I'm just like, how many people like how many people get missed? And so I think like a really big part of that is like more research and just like getting information out there as much as we possibly can. Like just like the Facebook group, for example, I referred her to the Facebook group. I was like, girl, there's like a ton of people in here, like go chat, tell a friend, like if there's anyone in your family that's afflicted with this, like share that with them too. Just because I feel like, especially for rare diseases, like it's really hard to get information out there. And so it's like on our part and also on the part of like clinicians to not only learn about it, but to also help pass along this information. And then the second point that I wanted to make was about like finding a therapist also. So like my family's from Jamaica, and like I could never go and tell my mom like, oh mom, like I'm depressed. You know, like depression, what is that? Like go read a book or something. So it's not something I ever like talked about with my family or like ever brought up. I actually have a therapist now who I got by accident. Um, so since I'm like really interested in all of this, like when I got to medical school, I started doing research, and I like did this project assessing the psychosocial needs of adolescents undergoing orthopedic surgery. And so I like came up with this survey that I was gonna administer to all these patients, and I was collaborating with a psychologist. And so I go to her office so that she could like work with me to write the survey. And we're like kind of using my own experience to guide our writing. And then it ended up being me like sitting on her chair for 2 hours, like talking about things that I didn't even realize bothered me in my life. Like, so that experience showed me, I was like, maybe I can benefit from like professional therapy. And so that's kind of how that started for me. And I was doing like sessions with her every 2 weeks, and now we do it like once a month, and it's super beneficial. I mean, I'm not like depressed in like a deep down state as I may have been before, but just following up with her and like keeping her up to date on how I'm doing, and just having someone there that I could continuously talk about these problems with, it's like super beneficial. Last point, because I don't want to like take up all the time, but we talked about things that like, so she's like a child psychologist that specialized in like adolescent like medical things. And so I was like, wow, like how did we get matched? That was like perfect match off the bat. And she has like shown me ways that like my current behaviors are manifestations of the things that I've been through like in childhood, and I'm always just like, oh my god, like this is nuts. So it like professional therapy is amazing, and once you find like that perfect fit, like it's amazing.
You've made my day.
Amber, you are amazing. Can I just highlight oh my gosh, everything you said is so important. So the trick with anxiety and depression, and it's very similar to chronic pain. With chronic pain, you just kind of push on through. You try and live your life. You know, you don't have a choice not to go to work. You don't have a choice not to take care of your kids. But it doesn't mean you don't have it, right? It's the same thing with anxiety, depression. You know, sometimes you just accept that I always have this terrible pit in my stomach, and I don't know, worry about social situations. Or you accept that you have, lower motivation. So I think that's a really good point. And I hope like your pediatrician, hopefully she screens for depression, because we try to pick up things like this. You know, hopefully someday we'll get to screen more advanced screening for XLH. But gosh, Amber, exactly what you're doing going into the medical field. You're going to be this like beautiful steward, and I hope will do lots of grand rounds around the country, and you can bring other folks with you, because that's exactly how you get the message out. And Mike participating in studies, and y'all are doing it. Like this is, I think it's a grassroots thing of just trying to get out there and share your story, and explain this is not the entirety of who I am, but still it's a challenge. And the idea that people aren't getting treatments is heartbreaking, or not learning about treatments that could be helpful for them. So thank you.
I think we've done a great job of sort of talking both about, reaching out or stumbling into professional help. Remember, I love the story that you told us. And also thinking about the peer support that you've reached out to. It sounds like finding the network has been a real benefit to folks. I'm wondering if you can tell us a little bit about sort of maybe peer support that you get out in your lives in general, but also what do you do for yourself? What kind of self-care things do you do on a regular basis, whether it's managing your mood or even coping with pain or discomfort or being tired? What kind of things do you do for yourself? Who wants to go first?
Yeah. Oh wait. Okay, go ahead.
I guess I'll address that.
There you go, Sarah.
For me, I have found it very helpful to practice mindfulness, and I meditate every day, and that helps me to be in tune with my own body. Um, I joked earlier this week that it took me 40 years to learn to listen to my body, and it's true. And now that I use those practices regularly, I'm able to know when to push myself and be more physically active and when I need to pull back. And I found that's also been helpful in managing if I have any pain. Meditation and mindfulness has been helpful to me. So has yoga and physical activities as I can tolerate it. And just being open and upfront with family and having a close-knit group of people has been helpful.
Amber, you had thoughts too?
Yeah, so I'm like the worst patient ever. My therapist would tell me to do things and I would just be like, that makes absolutely no sense. Like, she would be like, okay, when something upsets you, like, don't just walk away and like react and be upset. Like, think to yourself, why am I upset? Like, what about this situation is making me mad? Like, put actual emotion on it. And I'm like, oh my goodness. Like, if someone upsets me, I'm not gonna sit here and be like, oh my God, why am I upset? But I actually started doing it. And so like, just like what Sarah said, my therapist said, it's called practicing mindfulness. So just being mindful of how I feel. And so it's more than just like when people make me mad. It's like, okay, if I had a really long day and like my knee is killing me, that's like really annoying because I mean, other people have really long days, but like they're still able to like walk around and do stuff after me. Like, if I have a long day on my feet, I'm out for the day. Like, I have to be in the bed because I physically cannot move. And so just like being like aware of how I'm feeling and why I'm feeling like that, and also just like acknowledging that it's okay for me to feel like that. And then another thing for me, so like all of our doctors, I'm sure they do the same for you. They encourage you to be active because like that's supposed to help your like bone health and all of that stuff. So like I dance a lot. And so like that's like something that's like really important to me. I try to make time for it. Lets me clear my head. Also my doctor's happy that it's like physical activity. I also used to kickbox, which like she was not happy about. But I was like, my bones are fine. Like if it hurts me, I'm not gonna do it. So yeah, remaining active has helped me.
That's great. Mike, how about you?
Well, Mike stepped away for a moment, so I'm
okay,
going to go
Carrie,
first.
then tell
I
us what Mike
apologize.
does.
Kid crisis going on. So,
no.
So I was going to say, from my perspective, I think I found another mom with a spontaneous XLH child, and I think for me, connecting with others and trying to be a support for them, it has been really good for me. Another thing is, as we've gone out and done some speaking, I've met some spouses who have now felt they can, call and confide in me, and I love that they do that because what they're going through, I've been through, and you, obviously, that I love this man very much, so it's no disrespect to him, but it's hard sometimes to be the caregiver. And not that I have to do a lot for him, but emotionally, when you're trying to lift someone up when they're down and you feel like sometimes it's just chronic and it's like you just can't find a good day, like it's just bad day after bad day. I have my win the day because I'm trying to do one day at a time, but it's hard. Like it's emotionally draining. You as a spouse, like you just don't know what to do. I'm a fixer and I can't fix this. And um, other spouses that I've talked to, they're feeling the same way and they don't know what to do. And I can tell they're kind of at their wits' end. And so we've had like good conversations about like having like frank conversations with your spouse about being their own advocate and like what is our goal, like what do you want to see, and I'm going to help you get there. And I feel like for us, I do a lot of advocating, not just for Lexi but for Mike as well. Like I make those calls to the doctor and I say what he's feeling when it's sometimes hard for him to say how down he feels at times. And I think I don't know. So for me, coping has been trying to advocate and obviously exercise and things like that help as far as my mental health. But I think leaning on someone and letting someone help be your advocate, because it's hard. And so now, how do you cope?
I don't know. I'm a stubborn man. I'm not a stubborn old man yet, but I probably will be someday. I'm just not as open. I kind of just keep things quiet and deal. And I know that's probably not the best way to go about that. And I realize it. This time of year, I spend a lot of time in the woods, and I do a lot of just, that's like my self-calming, self-soothing. I do a lot of things outside, anything to get me outside, even though I work outside a lot. And actually, I'm now inside doing an inside job, which is funny now that I'm feeling so good. I now shifted to an inside semi-office job. But it's hard for me to say because I keep so much pent up inside until it's really, really bothering me. Then I'll open up to Carrie, and that's rare. I still take ibuprofen for my pain. I'm not going to say I don't, because that would be unrealistic. I definitely have bad days, and I have some great days. I can tell you, when I was really at my worst, I was dreaming about things that were like stopping me in my life. I would have dreams, and these dreams were realities. Actually, the biggest one that sticks out in my head is running on fire calls. I would literally have this dream that I was gonna trip going to the station because my brain says run, but my legs say stop. It's not happening. We're not working with you. And I still worry about that, although it just doesn't happen anymore. And I had multiple times where I'd get out of my truck to go running to a call, and there's twice that I fell flat on my face. I didn't really tell anybody about it other than right here and Carrie, but that's the reality of our situations.
Yeah, it's
And
interesting.
unfortunately, my mind was saying, yeah, it's the mind says go and your body says no.
Yeah.
Plain and simple.
Well, it's interesting, Mike, that you bring that up. When we did a study at Quinnipiac with some of the other adults with cystinosis, no, sorry, not cystinosis, wrong disease day, I apologize, XLH, and folks talked about thinking about their anxiety or even being told they were paranoid about worrying about tripping and falling. And how that's not just paranoia, that's a really genuine concern because of the injuries, right? But finding someone who could understand that as a provider was then really a challenge, right? Because I'm not being paranoid. I'm really worried that if I fall, this is going to throw off my whole life in so many ways. So I think that's a good example of, and your body was really getting that message across to you as well. So I also like the fact that you talked about being outside. I think many of us, when we hear mindfulness, we think about what Sarah talked about having a meditation practice or an exercise practice, that's what it takes to be mindful. But it's really just finding, right, something, and Jennifer, tell me if you think I'm wrong here, but to me, it's finding something that gives you some respite and some space. So if that's going outside or if it's just sitting and reading a book, like I think we think, oh, I got to do yoga. I'm not going to do that. But there's so many things that you can do in a mindful way that kind of let you step away from the things that are challenging or distracting or chaotic in your day. So there's such creativity to do that, right? Writing, all kinds of things. I'm trying to keep an eye on the chat. It's hard because we're having such good conversation. But there was a question, and I'm going to paraphrase it and kind of crunch it down a little bit. But I mentioned this at the beginning a little bit, how the experience of the surgeries or the injuries, if you've had injuries, can be really traumatic. And certainly I've seen with other conditions as well that some of those experiences really folks end up with sort of post-traumatic real symptoms in terms of flashbacks and nightmares and all of those types of things. So I don't know if any of you have seen that or seen that with your kids, or if you've talked about it with others, sort of what those experiences are like.
I can speak to that a little bit.
Thanks,
My daughter's surgery for her, I think, felt like a traumatic event. And then as her parent watching her go through that, it registered as a trauma for me as well. Which that part of it surprised me. I knew it would be hard for me, but I didn't realize how deeply it would affect me emotionally.
Was there anything
And at that time, I definitely,
yeah.
Yes. So she had her surgery right at the beginning of March, which was when all the pandemic stuff started to blow up. So a lot of the things that I would normally do to support myself were not an option. I couldn't go to a Zumba class. So I relied very heavily on mindfulness practices at home. And being outside too was helpful at home, going for walks, and talking with my family and friends about it as well. And she worked with her therapist to kind of process some of her feelings about it too.
Did you end up going back to your endocrine or your surgeons and kind of letting them know what that was like?
We had a teletherapy appointment as her follow-up. Or no, wait, no, she did have it in person. My husband took her. They did talk about it a little bit, yeah.
Again, it puts you all in the position of being the educators. Sometimes,
yeah.
Yeah, I have something to add about just like going through surgery. I think it's also really important to just like do your shopping for a surgeon as well, because there have also been like a ton of advancements in that world. So I had like bilateral external fixators at one point. And then the last surgery that I had like this internal lengthening nail that like no one ever knew there was anything going on. And so like a ton of surgeons have started using the internal nail, but there are still a couple that don't even know, like that haven't started using it. And so I think that that's another really important thing to talk about with your surgeon if you're considering surgery, just like what all the surgical options are.
that's a great point, Amber. Jennifer, do you have thoughts on this topic?
No, I think that's a really important point, because I think you could have a surgeon or any other medical or mental health person who maybe learned about something 30 years ago, right? And it's really their responsibility to keep up on their continuing education, and really do a lot of proactive. Maybe they meet their minimum requirements in order to stay licensed, but that likely wouldn't include XLH or may not include those newer techniques. So oftentimes going to an academic medical center where they're kind of beholden to know the latest research. And gosh, frankly, I've seen it a number of times at Harvard. It's the student who says, "What do you think about this idea? I just read about this new case series." And that's the reality. And, you know, in support of them, they're doing their best to stay up with their jobs and personal lives and things like that. But it again speaks to that role of self-advocacy. And if something doesn't feel right, and that's also thinking about peer support, you know, share with one another and say, "This is what my surgeon has recommended. Have you ever heard of this being suggested?" Because there certainly are old school docs who, with the best of intentions, might not give the most modern of care. Yes, yeah, I wish it wasn't a good point, Carrie.
So we're running out of time almost. So I want to sort of throw the question back to Mike and Carrie and Sarah and Amber. And you've given us hints about this already, but what are the things that sort of give you the sense of resilience as you're going out, and what are messages that you want to give to our audience today? Carrie, you go first.
Yeah, I think I said this a lot, but I think just being an advocate and being out there learning. I feel like every time someone explains XLH to me, like I learn it a little bit more, or I just love the way someone like kind of puts it. And it's like, oh, why didn't someone say that to me like that 10 years ago when, you know, I was trying to understand it better. So I feel like you can't stop learning and keep advocating. And like you did talk about, there's so many doctors with the best of intentions, but they just don't understand it. And whether it's your dentist or, you know, from a mental health perspective or your endocrine, just keep knocking on that door and keep asking the questions. That would be my biggest bit of takeaway.
Mike, you go ahead.
My takeaway is here I am. And so here I am, XLH Network, people with XLH. I think it's growing, unfortunately, popularity, but that's a good thing that XLH people are being reached, and we just need to reach more. I want to do everything that I can to let people know. I'm sad that I can't go around the country giving speeches that I once was recently. That has been huge for me, as well as Carrie. Amber, you know, it's amazing too. I see people on the street and I'm like, I wonder if they know that they have XLH, because it is noticeable. But there's, like I say, there's doctors that don't know. There's endocrines that don't quite understand. But there's hope, and that's why we're here. That's why you are listening to us out there, and you know, it'll get better and better. I can see it in my daughter. Her legs went from curvature to straight. There's some miracles out there in the workings, and hopefully, you know, everybody just can find out how on social network and get in touch, and we can keep reaching out.
Yep.
Thanks. Sarah, you want to go next?
I think hearing people's stories of bravery and strength, and my own story and my daughter's story, gives me hope. And also, you know, the direction that research and treatment is taking gives me a lot of hope for the future.
All right, Amber, bring it home.
Oh boy, no pressure. I would say what gives me resilience is that there have been like so many times in my life that I've been like, okay, why me? Like, why did I have to be the spontaneous case? Why did I have to be the one to take medication 5 times a day and have all this surgery and like have to be in pain and have no one understand me and all of those things? But then I think that a lot of times, like when something is going on in your life like that, it's very easy to focus on the negatives and like focus on all the woe is me. But one thing that I feel like makes all of us special is that we're fighters, all of us, and we are all incredibly resilient, and we've all been through like some really tough stuff, and we've kept going. And so that in itself should be a driver. I also feel like for all of us, in some way, this has given us purpose. I think for me, like, what I've been through in my life has like encouraged me to follow this career path and like work to make sure that some people don't have to go through some of the awful things that I had to go through. So that's what keeps me going. And then I guess like my little piece of advice would be like, just stay positive. Look for the good in everything. You are allowed to feel crappy though, like give yourself those days. But as long as you come back, ground yourself and remember the things that like really matter.
I think that's a great point to end on. We will go back to the chat and see if there's anything else we can answer and make sure we get those things out to you all in the audience after this session is over. But I think we can say goodbye for today, and thank you so much for joining us, for everyone that was listening in.